All right, let's jump right in. Today, we're going to put on our detective hats, our medical detective hats. We're going to follow a trail of clues, starting with what seems like a simple patient complaint and see where it leads. It all kicks off with a problem, one that just wouldn't go away. And here it is, the central mystery, straight from the patient herself. 6 months. Wow. Just think about that for a second. Half a year of dealing with this. That simple statement, that's our first clue. It's the thread we're going to start pulling on to unravel this whole thing. So let's get the scene set. We're talking about Mrs. XYZ, a 64-year-old farmer. And like we said, for 6 months now, something's been up with her right ear. Now, this wasn't something that happened overnight. No, this was a slow burn, something that gradually got worse over time. Okay, now this is where the real detective work begins. Look at these details. These are the breadcrumbs we need to follow. First, the hearing loss. It's not like she's completely deaf. It's been getting progressively worse. And here's a big one. She can hear better if you just speak up. Then there's the discharge. It's always there, but not a lot of it. And it's yellow, and importantly, it has a bad smell. You gotta remember, every single one of these details is a major clue. You know, a great doctor sees a list of symptoms not just as a list, but as a collection of signals, right? The key is to figure out what they all mean. So let's start with the first big one, the hearing loss. So when it comes to hearing loss, you basically got two main types. Think of it this way. Conductive hearing loss is like a plumbing problem. The sound is there, but something's blocking it from getting where it needs to go. Sensory neural loss, on the other hand, is more like an electrical problem. The wiring, meaning the nerve of the inner ear itself, is damaged. So that key clue, the fact that she can hear better when things are just louder, that's a huge tell. It points right at a plumbing issue, a conductive problem. All right, so we're feeling pretty good about our theory on the hearing loss. Now let's pivot to that second big clue, the discharge. What's that telling us? Believe it or not, the color and the smell of an ear discharge can be like a fingerprint, telling you exactly what kind of bug you're dealing with. Now remember, our patient's was yellow and had a foul smell. If you look here, yep, that points the finger directly at a bacterial infection, most likely staph or strep. See? We're already starting to zero in on the culprit. Okay, we've got our working theories. Now it's time to get some boots on the ground, so to speak. We move from asking questions to the actual hands-on physical exam. This is where we look for hard evidence to see if we're on the right track. And here's a super important part of any investigation. Sometimes the most important clues are the ones that aren't there. She didn't have terrible pain, no dizziness, no fever, no weakness in her face. The fact that all those big, scary red flags are missing tells the doctor something huge. It means we're probably not dealing with some crazy aggressive infection that's spreading. It's more likely something chronic and contained. So the exam itself is super methodical. It's not random. You start on the outside and you just work your way in. You check the outer ear, then the spot right behind it, then you peer into the ear canal, getting closer and closer to ground zero. And then, there it is, the aha moment, the smoking gun. The doctor looks in and sees a hole, a perforation in the eardrum. And that discharge we've been talking about, it's coming right through that hole. This one finding just connects all the dots. It's the plumbing problem we suspected, and it's the source of that chronic infection. Everything clicks. Now, to be absolutely sure about the type of hearing loss, doctors have these really cool old-school tuning fork tests. The first one, Rinne's, basically confirmed that sound was traveling better through the bone of her skull than through the air in her ear, a classic sign of that plumbing problem. Then the second test, Weber's, showed the sound was louder in her affected ear. So both tests came back with the same results, locking it in. We are 100% dealing with a conductive hearing loss. Okay, the investigation phase is pretty much wrapped up. We've collected all the evidence, we've got the patient's story, we understand the symptoms, and we have the physical exam findings. So now, it's time to put all the pieces of the puzzle together and officially name our culprit. All right, let's lay it all out on the table. We know it's chronic because, well, 6 months is a long time. We know it's suppurative, that's just a fancy word for pus forming because of that discharge. And we know it's otitis media, which simply means middle ear infection, thanks to that hole in the eardrum. You see how each clue gives us a part of the diagnosis name? So, this is it, the moment of truth. We've got all the pieces lined up. What's the final diagnosis? All right, let's get to the final chapter here. We've solved the mystery, which is great, but now comes the important part, figuring out what to do about it. And here you have it, the official diagnosis. Chronic suppurative otitis media, or for short, CSOM. Now, I know that sounds like a mouthful, but if you break it down, it's actually the perfect description of everything we found, right? A long-term, pus-forming, middle ear infection. Simple as that. And you know what's interesting? Even a tiny detail like her pulse rate backs this all up. It was 76 beats per minute, totally normal. That tells us her body isn't in full-on panic mode fighting some huge systemic infection. It reinforces that chronic part of the diagnosis. This is a long, simmering, local battle, not an all-out war. Of course, getting the diagnosis is really just step one. Now, we have a clear path forward. The plan is to confirm the exact type of bacteria with a culture test, get a precise measurement of the hearing loss, take a quick x-ray to make sure the bone behind the ear is okay, and then the final step, surgery. They'll go in to clear out that infection for good and repair the eardrum. So, we've cracked the case for Mrs. XYZ, which is fantastic. But why should this one story matter to you? What's the big takeaway for all of us? Because this whole thing is a perfect example of how our bodies talk to us. You know those small, persistent symptoms? The little things that nag you for weeks or even months? They aren't just annoyances. They're signals, they're clues, and listening to them, really listening, that's the absolute first step to solving your own health mysteries. So I'll leave you with this final thought to chew on. Just take a second and think about it. What subtle signals might your body be sending you right now? Because remember, listen.